Welcome back inside the Now Morning Show. This morning inside your spotlight, we're talking children and mental health. We have Krista Ali, psychologist from the Regional Case Management Unit at the Children's Authority, joining us. Good morning, Krista. Welcome back.
Good morning.
How are you doing this morning?
I'm doing well.
Yeah? All right. So this morning we're jumping into the conversation about children and mental health. As a parent, how do you even begin to determine if your child is having mental health challenges?
Yeah, so, when we're talking about mental health, there's a variety of things that we're talking about. So for the sake of this interview, what we will talk about will be very common sort of mental health issues that children are presenting with, such as our mood disorders, which is depression, things like that, our anxiety-related disorders, and other stress-related disorders, because as we know and we discuss every single time, we live in a very traumatic, stressful environment.
We just talked about yesterday. What happened yesterday was definitely traumatic and stressful for everybody involved, especially the children who live in that house or any of the houses that the roofs were blown off of.
Yes.
How do those things affect children's mental health in terms of you come home and you meet no roof, or you're sleeping in your bed and your roof is able to fly off, or whatever the case may be, things like that?
Situations like that would definitely lead to what I'm talking about regarding stress-related disorders, our PTSD, our anxiety. Now, these are terms that we throw around very often, and of course, what that does when a child comes home to a situation like that is that it disrupts their sense of safety, because now everything in their world has changed, and the space where you're accustomed feeling very safe is no longer that, because the roof is gone, So that definitely affects a child, where they no longer feel that sense of internal safety. And it's really up to us as adults to provide that level of safety and explain to the child what has happened. And in that way, they sort of get a better understanding of what it is they're dealing with, and then being able to cope from there. But we as adults definitely have a huge part to play and a role to play in supporting our child through that. And in front of our children, managing ourselves. And, our response did, because they would obviously feed off of that and follow suit.
Most definitely. But I mean, I want to go back to when you first mentioned the different stress-related disorders. Some of them you mentioned sounded like what we know to be just growing pains, as we call them, from the past, right? Where you go through your teenage years, for example, and you go through something resembling depression, you go through something resembling anxiety, but we aren't sure if it's just you being a teenager or if you're having a mental health disorder. How do we determine the difference?
I really like how you phrase that, something resembling a disorder, because that's quite often what it looks like when we go into general puberty pains, and being a teenager. How this would look different regarding a mental health disorder would be the level of functioning. So your child will not be able to function in their daily life and routine in the same way that a child who's just going through puberty might. So the symptoms would be a bit more pronounced. They will be a little bit more obvious, and they will be more persistent and enduring, as we call it. Because to diagnose a mental health disorder, it needs to affect your level of functioning in just everyday life, as well as it needs to be persistent. It's not that it's here for a day or two and then you're all right. It's enduring. So the symptoms of depression, the withdrawal, the sleep difficulties, the eating difficulties, the lack of interest in things that they usually enjoyed. These are things that we would start seeing much more pronounced in a child who's experiencing something that might be a little bit more than just growing pains.
How do we help them to cope with it?
By, again, modeling some good, positive coping strategies and behaviors, but also providing that child with an open line of communication. And of course, this is something I say all the time as well. The main thing that we need to do is have bonds and communication with our children, so that when they are experiencing something that's a little bit too much for them to handle, they feel safe and comfortable enough to come and tell us, so then we could try to figure out the situation together and determine next steps. What we don't want is children to feel like they have to deal with these types of things on their own, because that could, of course, lead to more serious problems down the line.
Is there a way for us to be more proactive? I know we keep mentioning the communication as one of the ways to be proactive to avoid these challenges, but to prevent mental health issues in the children. Is there a way for us to be proactive about that, or is that something that just happens?
Now, sometimes it's something that just happens, and it's something that cannot be avoided in some situations, because we have, obviously, we're talking about very different
wide
types
variety,
of wide variety of mental health issues. But the main thing that we can do is try to provide our children with holistic and well-rounded care. So, encouraging them to spend time outdoors, encouraging them to be proactive in terms of being in sports and after-school activities. Having a routine is something that's very important for children. Us modeling positive behaviors and good coping strategies, and encouraging our children to do the same and spending time with them so that their development is a bit more holistic in every sense.
Yeah.
That definitely puts them at a better chance of not developing mental health disorders.
You speak about development.
Yeah.
The signs that we're talking about, are they the same signs that you would see or similar in any way to developmental delays?
So developmental delays, what we call neurodevelopmental delays, that really just means that a child's brain is wired a little bit differently or works a bit differently. So how they would see the world and interact with the world would be a little bit different. But no, these would look quite different. The main thing is that we would start seeing it from much earlier on in our child's development. And the main way that we see that is that they don't meet their developmental milestones as compared to their peers. So, we would see children who they're not walking as quickly as other children. They might not be learning the colors and the alphabet, very typical things that we expect from very young children.
Even speech.
Yeah, even their speech. We might see that, it's not progressing in the way that their peers are or their siblings are. And, that is something definitely that we need to look into. Of course, not everything is going to turn out to be an actual, concern, but it's better to be a bit more proactive, as you said, and have it looked at by a professional, and then you can move forward.
Just to be sure and to be safe. In terms of treatment options for those who do have a mental challenge of some sort, mental health challenge rather, what treatment options are available? Should we start children at therapy? At what age should we start them if that is one of the treatment options?
And again, this will be based on what your child is specifically experiencing, but we do have available options. So in terms of the mood disorders, the anxiety-related disorders, the post-traumatic stress disorders that we discussed, therapy is, of course, a good option.
Right.
Having the child seen by a professional, psychologist or psychiatrist is always the best way to start that conversation, because sometimes medication might also be necessary. In our country, we do have various avenues that the public can access through the public healthcare system.
For free.
Yes, of
That
course the
part
wait
is
time
important.
it is free. Of course the wait time is a little bit longer, but I do encourage persons to access these services, such as the Child Guidance Clinic, the different regional health authorities as well. They do have like clinics called the wellness clinics, which are targeted to outpatient issues, such as what we're speaking about here. We also have the Calm Clinic as well as the stress relief clinics as well. And all this information can actually be accessed at safespace.com. That's a sort of a consolidated website that has information on almost everything that you would be looking at.
Safespace.com, definitely a place that you want to check out. You can also check out ttchildren.org and you can get more information, as much information as you need. Or you can just call the hotline at 996 or 800-2014. Krista, thank you so very much for joining us this morning and for sharing these thoughts. And of course, we always welcome you back to continue the conversation about the development of children, mental health of children, and anything as we talk about children. We welcome you back at all points in time. All right, enjoy the rest of your day, Krista. Ladies and gentlemen, we're going to take a quick break and we come back with more on the Now Morning Show. Stay tuned.
Not later, right now.